Khairuzzana Baharudin, consultant ENT surgeon at Pantai Hospital in Ampang. Before the break, we were talking about some of the nasal symptoms making up 92% of Malaysians who in fact do suffer from that, many of them then being diagnosed with allergic rhinitis. And now we're talking about sinuses in the country, otherwise known as Rusdom, also having high stats. A lot of people do suffer, and Doctor was just saying during the break that a lot of people don't even know that they in fact have this condition. What do a lot of your patients come to you and say?
They would normally come because of headache, okay? And then once they go to the normal general practitioner, they really have to they have to dig out all the symptoms from them. Then they will say they have blocked nose, they have flu on and off. Okay, then they will refer to me for problems of sinusitis.
Okay, so from rhinitis now we move on to sinuses. Do tell us what difference is between them.
Now, as opposed to allergic rhinitis, sinusitis is basically a common condition where the lining of your sinuses, so we have the picture earlier, when you have the lining of your sinus in the front part, okay, here in your cheek we have sinuses. So when the lining is inflamed, okay, and anything that block the nose, which cause blockage of ventilation to the sinuses, because sinus is normally filled with air. So now when it's blocked, the lining of it will be filled with germs. Okay, so it can be filled with virus, bacteria, or even fungus. Okay, so when this happens, that's when you get infection.
And does this, of course, interrupt with your breathing? People end up breathing with the mouth instead of using the nose.
True. So that brings to the symptoms of sinusitis. So the common, basically, symptoms will be blocked nose and nasal discharge. And commonly, when one is with sinusitis, the nasal discharge will be either yellowish or greenish, and that shows that they are having an infection. Okay, and they will definitely have reduced sense of smell. Okay, so they can't smell the food. Okay, can't smell their own perfume.
No fun.
Okay? Yes, you can't taste it better, and this brings to facial pain. So by that I mean they will have pain over your front part. Okay, we call it frontal region, on your cheeks. Okay, and when you bend forward, it just makes worse. So for Muslims, when they do the certain position here, you just feel something coming down on your face, heaviness. Okay, and you will also have pressure headaches, and the pain typically is between your nose here or over your cheek. You can have toothache as well. Okay, and when you go to your dentist, when they say your teeth is normal, chances are you may have basically sinusitis.
Okay. Now, for those who do know that they have this, what does this mean? Do they have to generally be on lifelong medication?
No. Okay. So the symptoms can be acute. Okay. So acute can be just few days. Now the chronic ones will be more than 3 months. Okay. That's when you have to go and see your ENT surgeon. Okay. Now what are the danger symptoms? Okay. Those are the common symptoms that slightly overlaps with allergic rhinitis. Okay, but the once you have fever, okay, you have bad breath, all right, and you have toothache, tiredness. Okay, tiredness, basically you're having infection of the virus or bacteria over your whole body from your sinuses. And when you have nasal speech, sometimes I even notice some of the TV broadcasts that they have nasal speech as if they're having cold, flu. I'm sure they're actually having sinusitis.
Okay, let's take a closer look at what really goes on in your nose when you are having sinusitis.
Okay. Now this is actually on the TV screen. You can see is endoscopic picture in the nose. Okay, so you can see the red ones is inflamed, the mucosal lining, and can you see the yellowish stuff there?
Yes,
okay, so that's the mucus. Okay, all right. So this is the one that either you can blow, okay, or it's going down to your throat, you're swallowing it, or you're coughing it out.
And if it's too much of the build of mucus, then it becomes sort of blocked and stiff and jammed up, right? So is there any particular thing that one can do at home to extract that out?
Alright, okay. There are a few things that we can do to treat this, okay? Now in that picture, it wasn't that blocked. It's quite clear, okay? So you can use what we have, nasal irrigation. So it's using salt in a bottle, okay? You dilute it and you can flush into your nose. So there are few preparations that you can use at home. But buy from the pharmacy is not using your own salt at home.
Do it at home. Okay.
Okay, it's a bit difficult. Okay. I think because there's prepared one in a sachet, so you just add onto the bottle and just shake it and flush it, so that'll be easier.
Okay, that is one of the home treatments that can be done. But if it's getting really bad and in interfering with daily life, then of course we'll have to come see a GP.
Yes. Okay, this is at the level of specialist. Okay, so you can see there. I'm using a scope. It's called rigid nasal endoscopy. Some of them got scared by seeing just the scope because it's rigid and it's quite long.
Yes, it does.
But trust me, it's not that painful. Okay, so we introduce the scope into the nose, and that's when you can see whatever is inside the nose. All right, this is one of the way to diagnose whether you really have a sinusitis or just allergic rhinitis. Okay, so when we see that, you can see blocked or too much mucus. So if you come to the ENT, we can decongest the nose, and we can even do suction for you.
Okay.
Okay, so basically suck out all the mucus secretion, and usually they feel so much relief because they can breathe normally, and it can even release your pressure headaches.
Okay, but then that's until the next time that triggers again.
Yes,
then it happens all over again. So is there surgery or ending to this?
True. Okay. To be honest, sinusitis or allergic rhinitis can recur, so it really depends on the immune system. But surgery is basically we reserve surgery to those who basically doesn't respond to the normal treatment. So what are the normal treatments? Okay, so the first line of treatment will be your analgesics, painkillers, which is really, really painful. Nasal decongestant, which is something to spray the nose. Okay, and nasal irrigation. Okay, that is very safe. Okay, because nasal spray some contains steroids, so not everybody can use it. But the saline spray, everybody can use it. For sinusitis, you need antibiotics. You may need antibiotics if it is bacterial infection. Okay, now once after treatment, it is failed medical treatment with antibiotics, then we start using doing CT scan to see how bad is the sinuses affected, because what we can put through the scope is only through the nasal cavity. We can't see what's happening inside here and also in the sinuses. So that's when we do CT scan, only after field medical therapy. So then we discuss with the patients whether you need to do what we call FAST surgery. It's functional endoscopic sinus surgery.
Okay, and is that a very lengthy procedure, or
it does carry risk? Okay, so we need to discuss with the patients, because for every surgery there is a risk. So for sinus surgery, of course it carries risk, but we have to weigh the benefits and the risk, because if we don't treat, for example, the frontal sinus, it may lead to brain infection. So that's the worst case scenario.
Okay, and what happens during that procedure? You basically remove all the mucus that's in.
Can we have one of the pictures of the sinuses?
Okay, let's have one of the pictures of the slides on the screen. Okay, while that comes up.
So what we need to do is to improve the drainage of the system. Of the sinuses, because if it is blocked, so we need to tease out the bone. Okay, sometimes some patient had trauma to the nose. Okay, it's like so deviated bone in the middle, so we need to correct that. And sometimes it is too swollen, or they can have polyps. Okay, polyps is basically an extra lining. Okay, it's like a sac that's blocking the sinus opening, so we need to remove that. So that the flow of the mucus from the sinus and drainage is better.
Okay, Doctor, before I let you go, what are some of your, what would you like to say to some of viewers at home who are, having this particular condition, who are currently suffering with this condition?
Now, I do advise those who really suffer from allergic rhinitis to come up first, at least to your general practitioner to get it treated, and to a certain extent come to our specialist clinic at least once in a lifetime. Okay, because some of you might need to do allergy tests to know what you're allergic to.
That's an important thing.
Yes, allergic testing, or at least to scope. Sometimes you have a deviated bone even from birth,
and you don't even know it.
Yes, you don't even know it. So it's worthwhile visiting us at least once in your lifetime.
Okay, well there you go. If you happen to be at Pantai Hospital Ampang, do of course consult with consultant ENT surgeon Dr Khairuzzana Baharudin. It's been a pleasure speaking to you.
Thank you very much.
Thank you for being on the show, and look forward to hearing more of your expert opinions perhaps next time. We'll take a quick breather, but when we come back, we have another specialist in the studio with us this time to talk about nose cancer. To stay tuned, we'll be right back.